Hello, my name is Muhammad Arif bin Sohaili. My case for CT scan is CT06. The patient is 8 years old boy presented to emergency department with complaint of intermittent stiffening upper and lower limb and also approximately 500 ml non-bilious projectile vomit. Patient also described general weakness and fatigue the previous night and on waking with no history of headache, diarrhea, fever or other symptoms of infection. He had also having locked hands and curled toes consistent with carpopedal spasm and twitching movement of his tongue. On presentation, he was a febrile but tachycardia with 156 beats per minute. The normal heart rate for children is 70 to 110 beats per minute. He also has tachypnea with respiratory rate 32 per minute, while normal range is 22 to 30 per minute. He also presented mildly hypertensive blood pressure with reading 125 systolic and 78 diastolic mmHg, while normal range is less than 120 systolic and less than 80 diastolic mmHg. ECG revealed a prolonged corrected QT interval with 480 milliseconds, while a normal corrected QT interval is less than 440 milliseconds. Noted that he had no focal neurological signs and have normal reflexes. In the past 4 months, the patient have experienced intermittent generalized abdominal pain, nausea, anorexia, vomiting, and mild weight loss with 3 kg. Abdominal ultrasound finding is normal. This patient is noted with series of vomiting. CT brain perfusion is an appropriate imaging to assess his neurological condition. Before the CT examination, make sure patient have fasting for at least 6 hours before examination. In this case, his liver function test is normal. Then, make sure patient have taken prednisolone if has allergy to contrast media. Then make sure the name and patient ID is correct. Ask the patient to sign the consent letter and then set the IV line for contrast media administration. Ask patient to remove any metal object in head area and then explain the procedure briefly and give a clear instruction to the patient. During the scan, check on CCTV for patient safety and then always communicate to patient with easy language. Tell and explain to patient before administer the contrast media, such as he will feel warm and flush sensation and also metallic taste in mouth. After complete the scan, disconnect the contrast media injector and then pull out the table and lower down the table. Then remove the IV line cannula. The imaging protocol is CT brain perfusion. Technique used is helical scan. Scan field of view FOV is set from vertex to base of skull. Firstly, we will do CT brain plan to see for any hemorrhage and infarction. Then, we do the CT perfusion scan after the contrast media administration. We will do dynamic scan where multiple scan at center of infarct or region of basal ganglia for 40 seconds. Then, wait for 5 minutes for contrast washout, then proceed CTA brain to look for vascular stenosis. The contrast media used for this scan is 50 ml with 4 to 5 ml per second flow rate. Scan delay is 5 seconds. Slice thickness is 5 mm. Patient is positioned supine on the table, hand by side, and we have to strap the head. The scan duration is about 25 minutes. CT brain perfusion show which area of brain are adequately or perfused with blood. CT brain perfusion provide detailed information on delivery of blood or blood flow to the brain. There are 3 parameters used in CT brain perfusion, which are CBF, cerebral blood flow, CBV, cerebral blood volume, and MTT, mean transmit time. The normal value for gray matter is 60 ml per 100 gram per minute for CBF, 4 ml per 100 gram for CBV, and 4 seconds for MTT, while normal value for white matter is 25 ml per 100 gram per minute for CBF, 2 ml per 100 gram for CBV, and 4.8 seconds for MTT. Based on this case, we want to look for the blood flow in the brain. That's why we use the CT brain perfusion. There is nothing to do with the nervous function.